For Trump's party of healthcare, there is no healthcare plan. Republicans have no intention of heeding President Trump's urgent demands for a new health care plan to replace the Affordable Care Act, fearing the potential political damage that such a proposal could cause in 2020 and hoping he will soon drop the idea, according to interviews with numerous GOP lawmakers, legislative staffers, and administration aides. Not only is there no such health care overhaul in the works on Capitol Hill, there are no plans to make such a plan. Senate Republicans, who were caught off guard by Trump's rapid shift to focus on health care last week, said the White House would need to make the first move by putting forward its own proposal. But administration, Senate Majority Leader Mitch McConnell are Kentucky. You acutely aware, nor does Senate Finance Committee Chairman Charles E. Grassley are Iowa, whose panel would be central to any such debate. When asked whether the Obamacare is something that's not going to be replaced unless the courts would declare it unconstitutional, Grassley said in an interview, "You won't know that." The renewed debate over health care policy was set off by Trump's abrupt decision last week, directing the Justice Department to intervene in a federal court case seeking to eliminate the ACA in its entirety on constitutional grounds. Although the outcome of that case is far from certain, the Trump administration's aggressive move in court sparked panic among many Republicans and a measure of glee among Democrats over the prospect of a protracted battle over health insurance for tens of millions of Americans during a presidential election cycle. Most Republicans. Trump's move also has baffled Republicans who wish he would have remained focused on the end of Special Counsel Robert S. Mueller's investigation into Russian interference in the 2016 elections, rather than plunging the party into another fight over Obamacare, which the party has tried and failed to eliminate for nearly a decade. But any plans to ride on the high of Mueller's findings, which, according to Attorney General William P. Barr, did not establish a criminal conspiracy between the Trump campaign and Russia, swiftly ended with a tweet around 1 p.m. last Tuesday as the president began making his way to the Capitol. That tweet in which Trump proclaimed the Republican Party will become the party of health care. Was how McConnell learned the president was interested in taking up the issue again, according to an advisor to the majority leader, who spoke on the condition of anonymity to describe internal GOP interactions. McConnell had previously wondered why Trump had suddenly invited himself to the weekly Senate GOP policy meeting at the Capitol, the advisor said. But McConnell later, another perplexed GOP senator speculated that the rest of the party will figure out the next steps the next time Graham goes golfing with Trump. The private pessimism from Republican lawmakers is nonetheless leaving Trump undeterred. In phone conversations with senators and discussions with White House officials, Trump has made it clear he sees health care as a priority. He announced before traveling to a political rally in Grand Rapids, Michigan, on Thursday that he had tapped a trio of GOP senators with health care expertise. Senators John Barrasso, the number 3 in Senate leadership, has drafted legislation promoting short-term, limited-duration health insurance that has caught the eye of White House officials. Cassidy, the president has praised Barrasso to other aides as someone who should be in the conversation, while indicating his interest in the block grant bill developed by Cassidy and Graham. Meanwhile, Scott has been focused on a narrower health care effort targeting the cost of prescription drugs and is close to introducing legislation. He spoke privately. "Look, I am going to try to get something done," Scott said, "but I think it accelerates everything if the White House had a plan." Indeed, there is little indication any health care plan will materialize or advance in Congress. A senior White House official directly involved in the discussions said there was no specific proposal. McConnell also had. Grassley said no hearings are planned on replacing Obamacare in his committee, and senior Lamar Alexander, Aldafarab, Mark Meadows are. "We are very eager to see what the White House submits for Congress to consider," said one senior Republican aide, who spoke on the condition of anonymity because they were not authorized to speak publicly. Until then, Operatives at the committees charged with electing GOP lawmakers, the National Republican Congressional Committee and the National Republican Senatorial Committee, have privately warned that the issue is not helping Republicans up for re-election next fall. Brad Parscale, the GOP has been eager to highlight divisions among Democrats over various proposals for a Medicare for All type system, which Republicans characterize as a dangerous lurch toward socialism. Instead, they think about 20 million Americans would lose their health coverage if the law was overturned, according to an analysis by the Urban Institute, an economic and social policy think tank. Tens of millions. They're trying to take away health care coverage from tens of millions of people, to take away protections for people who have pre-existing conditions, to take away protections for 25-year-olds who are on their parents' insurance policies, to take away protections so that people don't get cheated by their insurance companies. Senior Elizabeth Warren. Yet Trump has viewed his new health care push as a way to correct what he sees as his biggest political vulnerability, aides say. Trump has occasioned a lot of the squeamish Republicans will say they campaigned on this, and it's a losing issue. But in 2018, Seung-min Kim at washpost.com. Annie Linsky in Marshalltown, Iowa, contributed to this report.
Raindrop, drop top smoking, no cooking the hot pot. Fucking on your bitch, yeah, that. Looking up, open the park, pot.